The World Health Organization says coronavirus is not going anywhere anytime soon. All countries must explore ways to contain the spread of the disease and effectively manage its positive cases. Question is, how do you do that? Do you seize movement of people and goods across a given country, across borders, while allowing cargo to pass through? Popular opinion world over, but unpopular opinion in Tanzania. It's a diplomatic tiff brewing. Hello there and welcome to Metropole Debrief. My name is Ndiro Oganga. Following an increase in the number of COVID-19 cases detected along Kenya's border points with Tanzania and Somalia, President Uhuru Kenyatta on Saturday announced a cessation of movement of people between Kenya and the two countries. This move has, however, not been well received in Tanzania, with Tanzanian officials accusing Kenya of engaging in double standards over the testing of drivers at the border point entry. In a video that has since gone viral, Martin Shigella, the regional commissioner in charge of Tanzania's Tanga region, issued a directive barring the entry of Kenyan drivers and cargo into Tanzania.
Kwamba kuanzia leo, yani kuanzia sasa, wala sio kuanzia leo, kuanzia sasa, muda huu, kama kuna gari inatoka upande wa Kenya, imebeba shehena, imebeba mzigo, inaleta Tanzania, kuanzia leo, ni marufuku. Kwa sababu hatuwezi kuwa na bidhaa na Watanzania wanakaa hapa zaidi ya wiki nzima halafu wanatangazwa kwamba wana corona. Na tangu nimekuja hapa Ijumaa niliagiza sekta ya afya ipime baadhi ya watu wanaotokea Kenya. Kati ya watu waliopimwa zaidi ya wasafiri wanaotokea Kenya wa Kenya zaidi ya 19 wana corona. Sasa hatuwezi sisi turuhusu waendelee kutoka Kenya na corona zao waingize ndani ya nchi yetu. Kwa sisi kuanzia sasa tunaweka utaratibu.
But appearing before the Senate Committee on National Cohesion Tuesday, East Africa Community and Regional Integration Cabinet Secretary Aden Mohammed rubbished the directive by the Tanzanian Regional Commissioner, saying movement of cargo between the two countries will continue.
Tanzania have said, as Senator Pereno mentioned, that, okay, if Kenya has done this, we will not allow them their trucks and all this and stuff. I think that's a lot of rubbish in my view, because that was not what we have said. It is very clear our government have said we have not closed cargo movement. If they want to close cargo movement, is an issue that they will, have to deal with. Our position as a country is we will continue to allow Tanzanian truck drivers and cargo to come into Kenya.
CS Adan maintained that President Kenyatta's directive barred movement of passenger traffic between Kenya and Tanzania and not cargo in order to ensure the welfare of Kenyans who depend on Tanzanian imports is safeguarded.
By the way, as we speak, our vehicles are still going into Tanzania, just for information. So what people say on the podiums and what actually is happening, there could be some inconveniences and delays here, but things have not quite turned dramatically for the worse. It is our government policy as members of EAC to allow movements of cargo. So we want to respect that. Number two, we buy a lot of food from Tanzania. Our people depend on that, and we don't want to interfere with that.
Our efforts to reach Tanzania's High Commission to Kenya for comment on Tanzania's position regarding movement of Kenyan goods into Tanzania did not bear fruit by the time we published this story. For Metropole TV, I'm Ndiro Oganga. Let's take a look at a build of events that have led countries to resort to closing borders. We start at home in Kenya, where on the 5th of March, Wajir County, which borders Somalia to the east, recorded 5 cases of coronavirus. So this is Wajir, it borders Somalia to the east. Now, of the 5, 4 were Kenyans, while 1 was a citizen of Somalia. The 4 Kenyans had history of travel from Somalia into the country, and it is suspected that they contracted the virus from there. On the 12th of March, at the Kenya-Tanzania Hispania border, 2 Tanzanian nationals tested positive of coronavirus as they were trying to make their way into the country. Now, upon positive confirmation, they were sent back to Tanzania. The next day, on the 13th of March, the government collected samples from truck drivers from Tanzania, and out of the tested samples, 25 tested positive of COVID-19. 23 of these 25 were from Tanzania, 1 from Rwanda, and the other was from Uganda. Now let's fast forward to the 19th of May. Health Cabinet Secretary Mutahi Kagwe announced that Kenya's health officials have denied entry to 182 foreigners who had tried to enter the country at various points on its borders with Tanzania after testing positive of coronavirus. Of the cases, 126 tested positive in the main border crossing of Namanga. The others were diagnosed in 4 other border points. Now, another 18 coronavirus cases were picked up along the Kenya-Somali border in the northern region of Kenya. 14 of them tried to come into the country through Wajir, while the 2 were from Garissa County. Now, to mitigate further spread across the borders of the disease, President Uhuru Kenyatta resorted to closing Kenyan borders. Let's listen into this rational decision he made.
That there will be a cessation of movement of persons and any passenger ferrying automobiles and vehicles into and out of the territory of the Republic of Kenya through the Kenya-Tanzania international border, except for cargo vehicles, with effect from midnight tonight, Saturday the 16th, May 2020. There shall also be a cessation of movement of persons and any passenger ferrying automobiles and vehicles into and out of the territory of the Republic of Kenya through the Kenya-Somali international border, except for cargo vehicles, and this also will take effect from midnight today, Saturday the 16th, May 2020.
Well, that is President Uhuru Kenyatta. Now, what did Tanzania do, or where does Tanzania stand with regards to COVID-19? As of 20th of May, Tanzania had a total of 509 cases, 21 fatalities, and 183 recoveries. As you can see on the screen, the cases, 509 fatalities, 21, these are people who've lost their lives, and 183 recoveries. How about active cases? The number of active cases in the country stood at 305, with 7 people in critical condition. Now, despite the rising number of cases in Tanzania, Tanzania is yet to announce measures to contain the spread of the disease. The government does not enforce safety practices such as social distancing and wearing of masks in public places. In fact, President Magufuli, in an event, went on record to say that he is considering the reopening of schools in his country. Now, despite many truckers testing positive at the Kenya-Tanzania border, President Magufuli says he will not close the borders for the following reasons. Listening.
Na ndio maana ndugu zangu, mimi sikufunga mipaka. Niliheshimu majirani zangu. Tumezungukwa na nchi za karibu 8. Ukizifungia, maana yake umezinyima uchumi wao. Kuna baadhi ya nchi chakula zinategemea vyakula vya Tanzania. Mahindi, mchere. Sasa ukifungia nyama, kwa sababu sisi tunaongoza kuwa na ng'ombe wengi, maziwa, ukiwafungia wale wasipelekewe kule, kwanza umewadumaza uchumi wale waliotengeneza hicho kitu, lakini umewanyima pia vyakula watu wanaokuzunguka katika nchi hii.
Well, from that bite, it's clear that President Magufuli is keeping his borders open for the economy and nothing but the economy. However, what are other countries doing? Let's look at South Africa. And as of 20th of May, South Africa had reported 17,200 cases of coronavirus, 312 deaths, and 7,690 recoveries. Now, the active cases of coronavirus in the country are 8,928, while those in critical condition are 119 people. The country has been able to test 488,609 people and has a ratio of 8,251 tests per 1 million people. The country's president, Cyril Ramaphosa, on the 15th of March announced drastic measures with regard to foreign travel to contain the spread of coronavirus. Let's listen in.
Imposing a travel ban on foreign nationals from high-risk countries such as Italy, Iran, South Korea, Spain, Germany, the United States, the United Kingdom, and China as from 18th March 2020. South African citizens are advised to refrain from all forms of travel to or through the European Union, the United States, United Kingdom, and other identified high-risk countries such as China, Iran, and South Korea. This is effective immediately. Any foreign national who has visited high-risk countries in the past 20 days will be denied a visa. South African citizens returning from high-risk countries will be subjected to testing and self-isolation or quarantine on return to South Africa.
Well, South Africa is one of the African countries with the highest number of cases, and we're seeing the president taking a very firm stand. Unpopular opinion, one might say, but this is to ensure that South Africans are safe, and he contains the number of spillover cases of coronavirus into the country from foreign travel. That's for the South. Let's take a look at the West, and we look at Ghana. The West African country, as of 20th of May, had 6,096 COVID-19 cases, 31 fatalities, and 1,773 recoveries. Now, when it comes to active cases, Ghana has 4,292 cases and 5 coronavirus patients are in critical condition. The country has carried out 180,567 tests with a ratio of 5,826 tests per 1 million people. Now, with the country's number of positive cases increasing, yet the population is small, about 30 million people, President Nana Akufo-Addo on the 22nd of March closed Ghanaian borders in a bid to contain the spillover effect of the disease into the country. President Nana.
Borders, that is by land, sea, and air, will be closed to human traffic for the next 2 weeks, beginning midnight on Sunday. Anybody who comes into the country before midnight on Sunday will be mandatorily quarantined and tested for the virus. This closure will not apply to goods, supplies, and cargo.
We've looked at East Africa, South Africa, and West Africa, what they're doing to contain the spread of the virus in their country and the drastic measures they're taking in order to ensure that there's no cross-border transfer of the disease. All countries world over have one goal: to contain the spread of the disease and safeguard the health and wealth of its citizens. Sometimes these measures, though much needed, can rub neighbors the wrong way, causing a tiff. After the break, we review some of the measures that the Kenyan government has taken, how the neighbors have received them, and what could be the negative and positive implications of some of these measures. See you shortly.